briefly explain to our viewers how you view chiropractic actually provides benefit. How does it work?
So on the most traditional level, when a patient comes to see a chiropractor, they usually come because they have pain in their neck or low back, or they have headaches. And so a chiropractor is expertly trained in identifying areas of the spine that have fixations. And so if they feel a joint that is hypomobile, has lost mobility, it's not moving well, they can apply a controlled force either with their hand or with an instrument to increase movement back in that joint, which helps to decrease pain, decrease inflammation, improve mobility, and get patients well again. And
for many years, for decades, as you know, chiropractic was somewhat controversial. What is the current view of chiropractic with the National Institute of Health and indeed organized medicine?
So happily, the new low back pain guidelines have come out that are created by the American College of Physicians. It was published in the Annals of Internal Medicine. And this is considered to be the first line of treatment. So when you see your medical physician for spine pain, specifically low back pain, they're now supposed to recommend spinal manipulation, superficial heat, acupuncture, yoga as the first line of treatment for acute or subacute low back pain. So I would say that it is not only accepted by traditional medicine now in the United States, but it is incumbent on a medical physician to now recommend these things before medication.
Now, you mentioned prior medical therapies. I'll throw out a couple for you. For example, anti-inflammatory pills like Motrin, Aleve, etc. What are the pluses and minuses of using that to treat back pain?
As opposed to like NSAIDs?
Well, NSAIDs, yeah.
So NSAIDs are extremely dangerous. In fact, that somebody who takes NSAIDs for spine pain is 3 times more likely to develop a bleeding GI ulcer, as you are well aware.
Yeah.
And I think that number rises to 6 times more likely over the age of 60. And so the alternatives, NSAIDs and acetaminophen, which is shown to not even be effective, not even more than a placebo for spine pain. And then even worse, everyone knows that we are in the middle of a national opioid crisis. And so it's not a question of which works faster or what you're getting from your medical physician, but which works well and is the safest. And the research points to chiropractic as being dramatically safer than all of these medicine-based therapies.
So to a certain extent, to rephrase what you just said about the opioid crisis, many patients with back pain could avoid needing pain medicine with narcotics if instead they had a chiropractic series of adjustments.
Well, a chiropractic series of adjustments, as well as partnering with the chiropractor to become educated on what we call the chiropractic lifestyle, which is assessing and removing physical, chemical, and emotional stress that makes people unwell.
Right.
So we, treat the spine and use that as a gateway to returning proper structure and function to the body. But we all know that people these days are not eating well. They're extremely sedentary and their emotional stress levels are high. So while the chiropractic adjustment is our primary modality, partnering with a chiropractor as a mainstream physician in your life will also give you access to this type of health and lifestyle coaching.
Very good.